Hello?
Yep. You hear me?
Yes, I can. Can you hear me? Okay. Okay, and we're back and we are live. Hello to all the Kent Street students here today. Welcome to this CareerView live stream featuring Career Talks. My name is Nirajit. I'm your host, and today we have Lauren, an enrolled nurse who started her journey through the COVID pandemic. So this live stream is for those who are interested in a career in the healthcare industry, and it's really your chance to ask all the questions that you want to know about working as a enrolled nurse. For anyone who's aspiring or interested in this career, you can ask as many questions as you like, as personal as it can be. And today is all about giving you very honest and unbiased answers to what this is. Just remember, in order to ask questions, you have to be on the CareerView website, and there you can post your questions. Please try to ensure that all the questions are respectful as possible, no offensive language. Everything is monitored by the Kent Street staff and, of course, the CareerView team today. So let's start posting your questions. As you're posting your questions, I'll get Lauren. Thank you so much for joining us. Could you please introduce yourself and share about what you do?
Okay, well, I'm Lauren. I'm an enrolled nurse. I'm actually studying my registered nursing at uni currently. I've just turned 30, so I guess you could say I'm still young, kind of, maybe. I work on a cancer ward at a hospital in the city. It's a tough job, but it's rewarding in its ways.
Thank you. Yeah. Thank you, Lauren. Thanks for the introduction. We've already got a lot of questions here. First question we have from student is nursing exciting?
I would say yes, very, and sometimes no.
Very clear. Next question from another student is, can you tell us about what pathway during high school you took to take nursing as a profession?
That's a good question. I didn't take the pathway most people would take. I actually didn't finish high school for a variety of reasons, which I won't get into. I actually started with a career in childcare, and then 10 years later just saw an ad on Facebook for TAFE and actually went there and did a diploma in enrolled nursing, and then got a job during the pandemic because I graduated just as it started, which was scary. And now that I've been in the job for a while, I've decided to just go a bit further with my career and start registered nursing at uni.
Fantastic. Next question that we have from another student is, what are your thoughts on studying medicine?
Medicine as in being a doctor, I would never do it. I love the doctors on my ward most of the time, and some of the time I tell them off. And like me saying I'd never be a doctor, they would never want to be a nurse. So it's a personal interest.
Fair enough, Lauren. Another question we have from another student is, what subject you need for nursing?
Considering I didn't finish school, I would say nothing particular really, but you would want to have an interest in learning about people, and because people share all sorts of things when they're in a hospital, whether it be personal or not, and having some form of interest in human biology, but you don't go as in-depth as what a doctor would.
Excellent answer. Another question that we have for you is it hard to be a nurse?
Yes and no. Sometimes it's hard. You come home and you just don't want to talk to people at all because you've had enough during the day. And no, because you get to help people when they are at a very low point in their life, and you get to see how much you help them.
Fair enough. Another question we have from a student is, what is the difference in care given by an enrolled nurse and a registered nurse?
Nothing. It's just the job. And a registered nurse gets to do a little bit more. It normally runs the ward depending on where they are that day. An enrolled nurse will never have to run the ward. So if you don't want bigger responsibility, you stay an enrolled nurse, and obviously the pay is different. But
Fair enough.
It's not about money.
Fair enough, Lauren. Another question from a student, and maybe this has already been answered by you, but it says, do you need to do ATAR math to do nursing?
No, I am terrible at maths and it freaks me out. I have terrible math anxiety. And because I'm a cancer nurse, I give chemotherapy, so we do math all the time. You are not expected to know it off by heart. Um, as much as the teacher may tell you, you will never be able to use a calculator in the real life. We have them everywhere, everywhere. So, no, you don't need math.
Oh, fantastic. This has got a great question for you from one student saying, how intense is your schedule and how would you describe your work-life balance?
My work-life balance can be chaotic sometimes. It depends on how many hours you choose to do as a nurse in your work life. I would say nursing is very flexible if you're a shift worker. Um, some people say it's not, but it can be. But also there are jobs in nursing that can just be 9 to 5 or school hours. It's a largely flexible job and there are many, many opportunities.
Fair enough. And could you give us an understanding of your schedule from, your weekly schedule?
Well, I myself choose to do 2 weeks of nights every month. For me, I do 4 days a week, which so the way nurses are contracted for me, that's 64 hours a fortnight. My day shifts could be anything from an AM shift, which is 7 to 3, to a PM shift, which is 1 to 9:30 PM. And I could do AM, PM, or I could do 2 AMs, a day off, and 2 PMs. But my night shifts would be from 9 PM to 7:30 in the morning, but I only do 3 of those because they're longer, which I like.
Very clear, Lauren. Next question we have is from a student. What is the salary and is it fair?
The salary depends on where you rank in your job. It can get quite complicated. So an enrolled nurse will earn less than a registered nurse by a few dollars, which eventually adds up. But if you work public like me, every year that you work on the job, your pay rate goes up, your level goes up. If you're a nurse unit manager, which is the boss and controls the funding of the ward, does all the rostering, you'll earn a lot more than someone who works on the floor because your job requirement is more. So it depends on what you're looking for, money, life, and career-wise, to how much you'll earn. Because my pay changes a lot. If I do extra hours, it changes. If I do nights, it changes. I wouldn't say it's set to one standard.
Yeah. And is it?
But yes, it's not fair.
Okay. There's your answer there to that student. Next question from another student is, how social do you have to be as a nurse?
Well, it depends what you want out of being a nurse socially. I know nurses that they love nursing and they love care in a different way to me, and they're interested in the body. So they're a theatre nurse. They get to see surgery happen, but also for them, it's the best thing in the world that the person is asleep and they don't have to talk to them because they're on a table. For me, I like them awake.
Yeah, good response. Another deep question here is, do you regret not doing nursing earlier?
Yes, I do. I really enjoy it. I'm not going to say I regret being a childcare worker. I learnt a lot from that, but I regret not doing it earlier. But also, earlier on in my life, I didn't know I wanted to be a nurse, and I can't change that. But I have lots of experience from my life, so for me, that's enough.
Thanks for that, Lauren. Another question from a student is the study very intense to become a nurse?
Enrolled nursing, for me and a lot of people I did it with, we actually found the enrolled nursing way harder than registered, purely because enrolled nursing, you have to go in. There is no, where I did it, there is no online, and enrolled nursing is very hands-on. There's not a lot of theory compared to registered. Registered is uni, so uni is a lot of theory. Yes, you still have placement like with enrolled, but there is a lot more writing down and case studies and all what. So I actually thought that enrolled nursing was harder.
Yeah, Lauren. Next question. How much experience is needed prior to becoming a nurse?
None. You can become a nurse straight out of high school. It's none at all.
Ben,
You're all starting at the same place from a graduate.
couldn't be clearer. Another question from a student. Should I do human biology for nursing?
You don't have to. I did until I didn't finish school, but I only did it because I was interested in it. I didn't do it because my end goal was to be a nurse. If you don't do it, it's not the end of the line. You can still do nursing.
Very clear. Another question from a student is, have you ever been annoyed by a patient, and then how did you handle them?
Always, at some point, do you get annoyed by a patient? It could be something from the patient not listening to you and asking you the same question 3 times, or it could be you saying something and the patient deciding that you said something else and doing the complete opposite of what you said. Sometimes I walk out the room and I come back and I try again. Other times I ask a co-worker to go and talk to the patient instead. There's a lot of ways around it.
Very clear. As a nurse, do you experience any type of traumatic situation?
I would say yes. You are put in a lot more stressful and traumatic situations being a nurse, especially where I work, because I work with patients that are going through cancer and cancer treatment. Everyone deals with it differently, though. I myself can get affected by it, but the more you're around it, you become desensitized, which is not always a great thing, but you get used to it.
Thanks, Lauren. 5 minutes more left on this live stream, so please submit all your questions to all the students there. Question from another student is, can nursing help you get other medicine jobs later on?
Yeah, it can. You have experience in other areas and you can use that experience. I know doctors that were nurses prior and they became doctors purely because they hated the other doctors and how they did their job. But it's helped them a lot because they understand what I go through on the floor as a nurse. So when they talk to me in a different way than what a doctor that hasn't done that will, which is really nice.
Fantastic. Another question from a student is, how many years of study did you undergo?
So TAFE is 18 months, so it's around a year and a half. And uni, I do part-time. I'm still doing it. It's around 4 to 6 years part-time. So be a while yet.
Very clear. This follows on pretty well. Student has asked, was it hard to get accepted into university?
Yes. Yes, it was. At the time I applied, most of the unis weren't taking enrolled nursing students. They were only taking students that had graduated high school. It was very hard to get the unis to understand because they only look at numbers in the sense of these are students that will complete courses. It can be difficult, but you will find somewhere if you go down that path. Lots of people have. So there's lots of people you can talk to. But in the end, I found a uni that would take me, and that's what mattered.
Fantastic. Another question from student is it very gory?
It depends on what ward you're on. If you're on plastics, sometimes yes. Cancer, sometimes not always. Theatre, you'll see a lot more, and ED.
Clear. Another question from a student is, are there support groups for the nurses that need it?
Yes, there are a lot of, as there is for everything, a lot of Facebook groups by nurses for nurses. And there's also a lot of groups within where you work. My work especially, we have a wellbeing officer specifically for my ward who supports just the nurses because we look after people with cancer, so we see death a lot and they come around and check on us all the time. It's really nice.
Wow. Last few questions. As I said, we've got a few more minutes. This is an interesting one. How much do scrubs cost you?
um, well, these aren't my normal uniform. We do have a uniform. The hospital supplies our uniform to us for free, and we can change it out for new ones each year because uniforms eventually can get holes and all sorts and vomit and stains. Um, these are my Fun Scrub Friday scrubs, which I do have to buy myself. Um, I get them from Dangerfield, which we get a discount for, but I can't add up how much money I've spent on scrubs.
Excellent. Another question from a student is, what is the most memorable moment you've had, both negative and positive?
Um, the most memorable moment I've had that's been positive would be uh, before I went on placement. So it'll be 4 weeks ago now. One of my patients finished his last round of chemo, and his, for anyone that wants to go and do some Googling later, his neutrophils had come back to above zero, which is very good for someone that's been through cancer treatment, and which meant he got to ring the bell on his way out, which means I'm finished my treatment, my cancer is gone, and it's not coming back at this stage. So my journey here is done, which was really nice, and we all stand around and clap. Um, the negative one would be when we had a patient deteriorate really fast. We had to do CPR for quite a while, and the patient didn't make it. So, yeah, that was hard.
Thank you, Lauren. And that wraps up the live stream that we have for all of you today. Thank you so much, Lauren, and thank you to all the students who posted their questions. Unfortunately, we can't get through all the questions, but we will send all the questions that weren't asked on this live stream to Lauren for her to answer at a later time. But in the meantime, you can always find the opportunity to connect with Lauren if you have more questions to her on the CareerView website. Thank you so much for joining the live stream. Our next speaker who's joining the live stream is now a registered nurse, so she will give a completely different perspective on that. Lauren, thank you so much, and we will see you shortly. Okay, and we are back for our second guest on the CareerView live stream. We have Taryn here, and Taryn is a registered nurse, so she has all kinds of different experiences to what if you joined the previous guest on the live stream who was an enrolled nurse. Taryn is a registered nurse, and she will be able to give her experiences of working in the healthcare industry. Just a reminder for all new people who have joined the live stream, please ensure that you're logged into CareerView and then you can submit your questions there. Please ask any question that you want to know about this career, going from subject selection to personal to how does this mean in terms of this is the career path that you want to do. This is the opportunity where you can really ask those questions to someone who's recently been there and can share a very unbiased response to that. So fire away with your questions. Please keep it respectful. No offensive language, no offensive words. Everything will be monitored today by staff and by the team as well. So as your questions are coming in, Taryn, I would like, if you can, please introduce yourself to everyone here.
Yeah, my name's Taryn. I work at Royal Perth Hospital at the moment. I work on the acute spinal and the orthopedic trauma ward. So we deal with patients that become quadriplegics, paraplegics, broken bones and things like that.
Thank you, Taryn. Questions have come in already. So the first one we have is, wow, have you ever wanted to be a doctor?
I did think about it. And then once I actually got into nursing, I decided the doctors don't do enough hands-on stuff. So I wanted to stay a nurse.
Very clear. Next one from a student is, what grade do you need to be qualified for university?
So you just need the minimum ATAR, which I believe is 70 across the board now for ECU. So just your 70 ATAR.
Very clear. Taryn, another question we have is, what courses did you take in your years at high school?
So I did obviously the ATAR route. So I did just the standard maths, English. I did PE studies, human bio, and I did chemistry for year 11, and I did a religion for year 12.
And if I can follow on from that, this will answer a lot of students' questions. Are those subjects critical to become a nurse?
No, you literally don't need any prior subjects to get into uni for nursing. Human bio did really help though, because obviously it is a very human biology based course. So semester 1 in uni was pretty much year 12 at school, human bio.
Very, very clear. One next question a student has asked is, did you always want to become a nurse?
I personally did. I grew up with brothers that were in and out of hospital all the time. So I was around the scene a lot. But I know a lot of my friends that are nurses definitely didn't initially want to be nurses and just sort of fell into it.
Clear. Next question from a student is, is registered nursing better than enrolled nursing?
Depends what you want to get out of your nursing. We essentially do the same job on the floor. However, you do get paid significantly less as an enrolled nurse, and there's less career progression. So you can't upskill and become a CN, which is the red that I'm wearing, if you're an enrolled nurse.
Okay, very clear. I think you've answered this next question, but I'll ask it again from one student saying, what subjects do you need to learn for a higher chance of getting accepted into university?
I would probably say your English, maths, and human bio are probably going to be your main three. You do obviously need good English skills to get in. Maths always, because we do medication calculations, and human bio, pretty self-explanatory.
Very clear. Another question is, do I have to do ATA to become a psychiatric nurse?
So no, you don't have to, because obviously universities do have the transition program, so you don't have to do ATAR at school. It does obviously help if you already know that you want to go straight to uni, but you don't have to do ATAR at school.
Very clear. Next question a student has asked, how is the salary and is it worth it?
As much as we complain we don't get paid enough, my salary currently is well and truly enough for what I get paid. And WA is one of the best paid states in Australia, just below Queensland.
Very clear. Next question is, would you say that human biology is very tough?
At school, I didn't find it tough. But again, it just depends how much effort you put in. I knew I needed to do well, so you put a lot of effort into those subjects.
Another question is approximately how many hours do you work per week?
So I work 32-hour week, sorry. So we base ours off fortnight. So I do a 64-hour fortnight, but you can do up to 80 hours.
Nice. Taryn, next question we have is there something you don't like about nursing?
There's quite a few things, to be honest. I think it's just like you obviously have those patients that don't appreciate everything that we do for them, and that can be really tough, but they are overshadowed by all the good stuff. So you just have to toss up pros and the cons, but the pros definitely outweigh them.
And Taryn, if you don't mind, could you give some examples of things you don't like?
A lot of the part, especially in my hospital, so I work in the city centre, we're a big public hospital, so we get people that obviously don't have health insurance, a low socioeconomic area. So we get a lot of drug addicts, people that have had accidents because they've been intoxicated and things like that, and they don't always want our help initially, and they do kind of fight us on some things, and you do get a large psychiatric population as well, and we do also deal with prisoners from obviously prisons. So those patients can make it quite challenging.
Fair enough. Taryn, next question is what are some of the personal and professional skills essential for a registered nurse?
Communication would be a major one. Without it, our job would fall apart. We have to talk to so many different professions, not just other nurses and patients, doctors, OTs, physios, anyone you can think of that works in a hospital, as well as family members as well. Also, time management skills. You would get nowhere without being able to time manage. If you're someone that likes to procrastinate, it's probably not a good area to go into.
Very clear. This next question is from Jaden, has asked, is taking psychology, not ATAR, enough to be a psych/mental health nurse?
So you actually don't need any extra subjects to become a mental health nurse. My first year in my nursing field after I graduated was as a mental health nurse, and I got through on just the subjects that I did. You don't actually have to do anything outside of the normal registered nursing course.
Very clear. Another question from a student, a bit deeper, saying, do you experience trouble from the patient's family when the patient deals with trouble during the treatment?
As in, do the family members give us grief? Absolutely. I've had my fair share of families yell at me, but most of the time it's just because they don't know what's going on and they just need things explained to them, and they usually settle down pretty quickly. So it's not too bad. Okay,
this next question is interesting. It says, do you have to face yucky stuff working as a nurse?
Yeah, absolutely. It just depends on where you work. Like in my area, we work in orthopedic trauma, so we see a lot of open wounds in big areas, so hips, your calf muscles, your thighs, those big muscly areas. A lot of abdominal wounds as well. So we do see a fair share of trauma. But if you work in somewhere like oncology, things like that, you don't actually see any open wounds. It's all sort of internal and you don't really get exposed to it as much.
Okay, excellent. Tara, next question. How many years of study did you undergo?
So I did, 3 years in uni. I went straight through. So a registered nursing undergraduate is just 3 years.
Very clear. Another question is, how was your experience on the first day of work?
I was petrified, to be honest, because you learn everything at uni, and you know what you only know what you're taught, and then you're thrown in the absolute deep end. But there are so many people there to support you. But like any new job, you're actually petrified, and you just realize you've got all these patients, under your care. So it's a big deal.
Fantastic. Last 5 minutes of this live stream. We've got a few more questions, so let's get through it. Next one is, what is your favorite part of being a nurse?
Just the progress you see in the patients, especially my patients, they're long term. We have patients that stay up to 100 days. So seeing the progress from when they first get there to when they leave us is absolutely amazing.
Fantastic. Another question is, would you suggest being a nurse if you get dizzy at Gore?
Yes, because there's so many different places you can work. You can do community, you can work in GP clinics, you can do mental health that you don't see much gore at all over there. There's so many different areas you can work that don't see blood.
Nice, Karen. Another question is, what advice would you give to someone considering a career in nursing?
I would actually say if you're not 100% sure, give it a go, but also there are different ways to get into it. You can do the enrolled nursing, which is quicker. It's only 18 months, and then you can get into the workforce. And if you decide you don't want to do it, you haven't wasted 3 years. But you can also do the assistant in nursing course at TAFE, which is actually only like a 6-month program, and you get to be in and around nurses on the floor. You get to see what they do and get a bit of exposure without doing your whole degree.
Very clear. This question has come up a lot from a few students. If we want to become a nurse, can we take a general pathway in high school?
Yeah, absolutely. You just would have to you could do obviously enrolled nursing at TAFE and then transition through uni to become a registered nurse, or you can just do the transition summer units at university. So they do like a 6-month course where you go from not having an ATAR to being allowed to enroll in uni.
Okay. And another question we have is, how often do nurses deal with needles?
Daily. I don't stab people daily, but we use needles to draw up medications and things. So every day.
Okay, we got the last few minutes here, so please submit your questions. We got another question is, how do you become different type of nurses?
So you sort of just you can obviously apply. Obviously, we have grad programs after we finish our degree, and you get slotted into areas in that, but you can literally apply in any ward inside a hospital once you're in a hospital. So I would just apply for a general pool, and then you can just move around and see what you like.
Fantastic. Another question that has come through is, how do you stay updated with the latest developments in healthcare?
So that's another part of my other role that I do, staff development nurse. We get daily prompts when we're on the floor. So they tell us at each of our shift changeovers, they give us all the updates. We get emails constantly. They're posted all over the hospital.
Fantastic. Last few questions is, do you recommend, and I think you've answered this, but do you recommend a nursing career who cannot face yucky stuff at all? Or do you think we'll overcome it someday? So we'll must be a few people.
Yeah, you do get used to it. Definitely when I first started, there were some things I was like, oh, that's gross. But you sort of do get used to it. And it just comes sort of part of your job. And when you leave, you actually kind of forget about half the stuff that you've seen. So it does get better.
Okay. And last two questions I'll take is, how can nursing help you get into high levels of medicine later on?
So when you want to do medicine later on and become a doctor, you have to have an undergraduate degree. It can literally be any undergraduate degree. Obviously, a base of nursing would be fantastic because it is half of the doctor's job is to understand the human bio side of things, and it's a really good stepping stone to understanding the whole working environment. So it would be good if you're wanting to become a doctor later. It's not necessary though, but it is. I prefer the doctors that do nursing first.
Okay.
Good doctors.
Fantastic. Last question that we have for you, and it's an interesting one, but I'm going to ask it is, would you recommend, if you're petrified of needles, this career path?
Yeah, I have a friend that doesn't like getting needles herself, but has absolutely no problem using them in her nursing career. So it definitely depends, I guess, what your fear exactly is. But you don't ever, get stabbed in your day-to-day work life with needles. So if it's just you don't like getting them, it's absolutely fine. So yeah, I definitely recommend still looking into it.
Still looking into it. This student has asked this question a few times on Livestream, so I will ask it. It says, how did you handle a patient? How do you handle a patient, and how do you decide what you need to do?
So a lot of it just comes from experience. Wards get specific types of patients, so we get repeat types of injuries and things like that. And so from experience of previous patients, you get to know what you need to do. A lot of it is doctor driven as well. They'll see them down in the emergency department before they even get to us. So we usually have doctor orders before they get to us, and we just implement those. Otherwise, a lot of it's just practice. You learn it all through uni. So it's not as daunting as it seems.
Thank you, Taryn. And that's it for today's live stream. And to all the students who joined the live stream and asked questions, thank you. As I said, if you would like to connect with Taryn after, you can visit the CareerView website where you can ask her more questions. Taryn, thank you so much. To all the students who joined the live stream, once again, thank you. You'll see at the bottom of the page, there is a survey. You can share some feedback on the live stream, what you think, what worked, what didn't work. Did you enjoy the guests? Did you enjoy the advice? Was it helpful for you to really make sure that you're making the right decisions moving forward in your future careers? So thank you so much to everyone who's joined the live stream. We hope you've enjoyed it. And once again, Taryn, thank you again for being part of this.
No worries.
Okay.
Thank you for having me.
Thank you. Bye-bye.